Hello, my name is Peter Lawrence and I'm pleased to introduce the October issue of the Journal of Vascular Surgery and to highlight 4 outstanding papers which are freely available for the next 2 months. Our editor's choice article for this issue is Trends in the Use of Cerebrospinal Drains and Outcomes Related to Spinal Cord Ischemia After Thoracic Endovascular Aortic Repair and Complex Endovascular Aortic Repair in the Vascular Quality Initiative Database by O'Coin and co-authors. Although spinal cord ischemia is a dreaded complication of thoracic and complex endovascular aortic repair, controversies exist surrounding the prophylactic versus therapeutic cerebrospinal fluid drainage due to concerns regarding catheter-related complications. This study evaluated the differences between patients who developed spinal cord ischemia despite preoperative CSF drain placement and those treated with therapeutic postoperative drain placement. All elective TEVAR and complicated EVAR procedures for degenerative aneurysms in the SVS and VQI registry from 2014 to 2019 were analyzed. 3,406 TEVAR or complicated procedures had an overall spinal cord ischemia rate of 2.3%. 48 patients had the ischemia with prophylactic CSF fluid drainage placement, and 24 had spinal cord ischemia and had therapeutic CSF drains placed. Spinal cord ischemia outcome was significantly worse for the therapeutic group. 79% had documented permanent paraplegia, compared with 54% of the prophylactic group. Spinal cord ischemia patients receiving postoperative therapeutic drainage also had worse survival than those with a preoperative prophylactic drain placed. The CME article for this month is entitled Late Outcomes After Endovascular and Open Repair of Large Abdominal Aortic Aneurysms by D. Guerre et al. They determined the effect of abdominal aortic aneurysm diameter on late outcomes after aneurysm repair. Of the 21,119 aneurysms repaired and reported in VQI, 15% were aortic aneurysms greater than 65 millimeters, with 19,000 treated endovascularly and 2,100 with open repairs. After EVAR, patients with large abdominal aortic aneurysms had a lower 5-year freedom from intervention, freedom from rupture, and survival. However, after open repair, the freedom from intervention or re-intervention, rupture, and survival were similar to smaller abdominal aortic aneurysms. The authors concluded that in patients with large abdominal aortic aneurysms who are medically fit, open repair should be strongly considered. The next article by Hicks and co-authors, Evaluation of Revascularization Benefit Quartiles using the Wi-Fi or Wound Ischemia and Foot Infection classification system for diabetic patients with chronic limb-threatening ischemia. They evaluated high benefit or quartile 1 to questionable benefit or quartile 4 patients who are diabetic with chronic limb-threatening ischemia. 136 patients underwent revascularizations of 187 limbs, with an endovascular approach in 67% and open surgery in 33%. 27% were in the quartile 1, 32% in quartile 2, 20% in quartile 3, and 21% in quartile 4. The estimated 1-year major amputation rates were 7%, 4%, 7%, and 26% for those in the quartiles 1 through 4, with 26% in quartile 4. The quartile 4 group had a major amputation hazard ratio of 4.26. Of the 14 limbs requiring the major amputation, 56% had a patent revascularization at the time of amputation, including 6 of 9 limbs in the quartile 4. So quartile 4 limbs frequently require a major amputation despite a patent revascularization. And they concluded that wound size and infection are very important factors behind the risk of major amputation. The final article by Gray and contributors is Revascularization of Asymptomatic Carotid Artery Stenosis Improves Balance and Mobility. The authors assess the effect of restoring blood flow to the brain by carotid revascularization on balance and mobility in patients with high-grade carotid stenosis of greater than 70%. 20 adults underwent carotid endarterectomy and had balance and mobility assessments before and 6 weeks after revascularization. Depending on the specific test, 25 to 90% of the patients scored in the impaired range at baseline. After surgery, there was a significant improvement observed in walking with dynamic movements. The proportion of patients with a high fall risk decreased from 90% to 40% after surgery. In this small study, carotid revascularization improved the patient's balance and mobility, and the greatest improvements were in patients most impaired at baseline. Thank you for watching. For more information, please follow us on social media, and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery. Remember that these articles are free to read until the end of December. And thank you for your attention.